Well, hello and good morning to you. This is Dr. Yonnette coming to you with another discussion, another bit of information on your infant and how you can understand and observe your developmental milestones that are taking place in your baby. Yesterday on Facebook, I saw a couple of babies being walked, and it's so important to take your baby outdoors and give him or her the sunlight and the vitamin D that he or she needs. Wonderful activity, moms and dads. So today we are talking about sensory skills. Sensory skills. And sensory skills are very important to occupational therapists. You may know that I'm an occupational therapist. So I want to really focus in on this. Sensory skills and fine motor skills are very important. Today we are looking at what sensory skills are and how you can help your baby to develop those sensory skills. And during this time, we're just focusing on infants 0 to 3 months old. So I want you to cue into this. When we talk about sensory skills, we are talking about things such as vision, hearing, touch, smell, taste. And for occupational therapists, we focus a little bit more on things like vestibular. And vestibular really refers to the balance and the positioning of your head in space. And then we also look at what we call proprioception, which is the information that the muscles and joints receive and how they interpret that information. Now, when you look at sensory skills are the skills that are responsible for total development, because we take in so much and respond to so much that comes into our bodies through our hands and our eyes, our ears, the taste, and that helps us to determine how to move and what to do. So how do you help your baby to develop these so needed sensory skills? You want to incorporate multiple senses when you're interacting with your baby. Touch, movement, body awareness, sight and smell, so that your baby is getting information coming into him or her in various ways. So use play mats. When you use play mats, or when you put a baby on the floor, put him on different textures so that he can feel the differences and learn to appreciate them. You also want to have feel books. I remember when my son was growing up, I had books that he could touch, and you feel the different textures in those books. Also, when you are doing movement activities with your baby, like rocking or swaying or bouncing, use various activities. Don't always just swing, or don't always just bounce. Use a combination of those activities so that the baby gets various experiences. And then we also talked earlier yesterday, when we talked about vision, use different colors. And for babies or infants 0 to 3 months old, you want those softer, cooler colors of lemon and sky blue and those kinds of things. That would be give the baby varied experiences, varied visual experiences. Okay, so now we're talking a little bit about smell. So you want to use lightly scented lotion. But if you're a mom or a dad who is particular about adding scents to your baby's lotion, just use garden herbs. And this will stimulate the sense of smell. Music is my thing. I always talk about music and reading. So you're listening to music and playing, have the baby play different instruments. And what do I mean by having the baby play instruments? Because the baby really can play at this age. Just hitting on those rattles and different things that give different sounds. So the baby again is stimulating the auditory system. He or she is getting auditory input that will stimulate that system. And then when we get to the baby gets to eating different foods at about 5 or 6 months of age, you want to give them a variety, but we're not going to get into that today since we are still at the infant stage. Now, I also want to talk about positioning. Positioning is another sense that helps us with vision and hearing and touch and taste and smell, and they all develop or begin to develop during the infant months of your baby's life. We want to make sure that you have that baby has a positional sense where his body is, and that's why you see babies tend to move and they kick and they try to rock and move themselves, so that enriches their experience in terms of where they are in place. So a lot of times what we do, we put babies, we put children on swings, and we rock them in rocking chairs, and we cuddle them, or we swaddle them in blankets. You can hold the baby up right over your shoulder, or you hold the baby in a lying position over your stomach. And when you go for walks, you want to make sure that the baby, you can take the baby in a stroller, which is fantastic and which is what we normally do, but you also want to vary those experiences by wearing a baby carrier sometimes, or a backpack, to help stimulate that positional awareness. And then, when I was growing up, one of the things that my mom did, and I did too as a mother, is that I did baby massages. We used to, apply the baby oil and then just massage out the arms and the legs. And after we were finished that, you roll the baby on the back and you did the massages on the back as well. And then you did the exercises where you cross the arms, then you cross the legs, and then you did cross the arms and the legs together, going alternately across the midline, and that helps the baby develop and grow well. So today we basically focused on talking about developing your sensory system, developing the sensory system in babies, having a sense of sensory development is very important, because it's through the sensory system that we are allowed to explore our world and make meaning of what we hear and see, and what we reproduce or give back to the world. I hope you're having time, spending time with your baby, bonding nicely, and loving the experience. So today I want you to focus particularly on helping your baby to develop his or her, baby AJ or baby Mary, baby Dominic or baby Sue, to develop their sensory skills so that they can make sense of their life. Thank you for joining me this morning. I look forward to speaking with you again tomorrow. Have a blast of a day.